Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health, one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode, and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome back to another episode of the Things I Want My Daughters to Know podcast. Today, we are having a really interesting conversation about a topic that I know nothing about. So I am going to be just as curious as all of you listening. I'm really excited to be educated and informed about this topic. Alexa, welcome. I'm really excited to have you here because this podcast is all about having open, honest conversations around women's health. And I think today we're going to be talking about something that is possibly quite sensitive, but also that I don't think anyone listening really has ever heard about this, knows the phrases and the terminology that you're going to be using. So tell us for a minute who you are, what you do, and we'll get straight into it.
Hello, Jack. Thank you so much for inviting me on this podcast, and I can't wait to dive in. So my name is Alexia Leachman, and I clear head trash. That's basically what I do, which is anxieties, fears, doubts, and all of my work came on the back of my own experience of having tocophobia, which is the fear, the extreme pathological fear of pregnancy and childbirth. Now, no one really knows about this, and I'm sure many listeners right now, when I say the word tocophobia, are probably going, what is that, right?
Yeah,
Tokos
we
from
know
the
the word
Greek.
phobia, but we don't
Yeah, we
know that
understand
first
phobias,
bit.
but the other bit, what's that? Well, it comes from the Greek toko, I think, around birth, childbirth, right? But even then, when I had it, and I had it for my whole life, and when I fell pregnant at 36, I didn't know that I had it, right? So this is affecting loads and loads of women, and they don't even know they have it until they see the lines on the pregnancy test, until they're put in a corner where the body clock's ticking and they're like, oh my goodness, he says we've got to have kids and we've just got married, we've got to do this now. And now the panic starts rising. And so I didn't have any of that going on because I just managed to deny that completely. So just to
Right.
give you a context, is exactly how well tocophobia was masking all of that for me. I was 36 when I fell pregnant by accident in a long-term relationship of about 8 years. And when I fell pregnant, not only did I have this massive, massive shock, body shock experience when I saw those two lines, but one of the things I was thinking was, what if he doesn't want kids? We hadn't had the kids conversation, right? So I was
Mhm.
36 in an 8 year relationship and I hadn't had the kids conversation. So when I say that tocophobia and what I now call reproductive anxiety disorder is shaping women's choices from behind the scenes without them realizing, that is exactly what I mean, right? And I was putting all of my effort in career, in work, because that was the right thing to do, in inverted commas,
Right.
without realizing that actually there was a whole swathe of possibilities that were just being hidden from me because I couldn't go there because of this deep level of fear. But what I've learned through working with women now for over a decade, well, nearly 15 years, because of since my own journey, is that this is so much further, far reaching than just simply a fear of pregnancy and childbirth. It's actually
Okay.
an anxiety disorder that affects so much more, that starts in women when their reproductive cycle kicks in, puberty, and probably right through and past menopause. And so until we start recognizing that, and really shining a light on it, and I'm grateful for this conversation today, then we can really, it stops us from doing anything about it. So back to your question, who am I, what I've been
Yeah.
doing? Well, I had tocophobia and I figured out a way to self-heal it. At the moment, a lot of the narrative is, well, it's all right. You'll feel okay. It's okay. Take some deep breaths. Just have a C-section. Oh, it's natural to feel a little bit scared. No, this is not a little bit scared. This is a full body breakdown of visceral fear that I feel in my bones. And it's not just fear. So phobia is really not doing the condition justice at all. And I've got a podcast called Tocophobia, all about tocophobia. We had a phobia expert on who's got a office on Harley Street in London, which is the address for health professionals. You know, if
Yes,
you want to see the
yes.
best in the world, you go to Harley Street. So we had a phobia expert on the podcast. He had never heard of tocophobia, right? So that tells you everything you need to know. So this is
Okay,
why
so
I'm
I'm
grateful.
going to stop you and because there's so many questions and we need to go back so many steps. Firstly, I want to say, as I mentioned to you before we hit record, I am blessed with 5 children. All of them, I gave birth to them, and for me, that was never something that I experienced. And I just want to be open about the fact that I know nothing about this, as you've explained, that very few people know about it. But I really want to stay curious about the conversation as someone with 5 kids. And you've said that you've had the condition and you're blessed with 2 kids. Um, we know, well, let's firstly go back about what the medical establishment knows about this, and then compare it to and sort of maybe bust some myths about women who say, I just don't want kids. I never wanted kids. I don't want kids. Are they experiencing this tocophobia without realizing? Are they sort of, like covering up this fear just by saying, I don't want kids. I never wanted kids. I want to stay independent, or whatever their rationale is. Um, is there something hiding behind every statement like that? And then so let's start with that, because I know there's lots of steps we want to go on this conversation. So
So
start with sort of what the medical system knows and understands and is aware about this, and then sort of that way that women who have
yeah.
chosen not to have kids, how they relate to it.
Yeah. So tocophobia is currently defined as the pathological avoidance of pregnancy and childbirth. And there are two types of tocophobia. There's primary tocophobia and secondary tocophobia. Primary tocophobia is women that haven't had a direct experience of birth or anything to do with reproduction in that way. So they've not had, they've not had a termination, they've not had a miscarriage, they've not embarked on any aspect of that journey. Whereas secondary tocophobia relates to having a trauma that's around a birth experience. So you've had a traumatic birth, and now you have a fear of it because of your traumatic experience.
Right.
The piece that I really want to shine a light on is those with primary tocophobia, because these are the women that are really suffering, that don't understand. They don't understand why they have a fear of something they've never experienced. Women that have had a difficult birth, they can point to it, they can go and get healing, they can go and they
There's a
know what's going
rationale. There's
on.
like a rationale for it.
Yeah, they understand the situation. That's not to dismiss birth trauma and all of those things, but those with primary tocophobia have no idea that what they're experiencing is this thing. So at the moment, there really isn't any. If you do like extensive research into what can you do around tocophobia, there isn't anything. And I've had many well-read, intellectual medical women come to me, therapists, doctors, who've done all the research, and they've come to me as a last hope, because there's nothing out here for this. I'm just being told I should get a C-section or get some CBT, but I know that's not going to work because that doesn't touch the sides. So they come to me as almost like a last resort, right? So there
Yeah.
isn't really
But these are
a
often these are
solution.
women who are already pregnant, whose
No,
fear of pregnancy is.
no, they've identified they want to be mothers, but they've identified that they're very, very scared. So
Okay.
some women fall pregnant, they cannot handle being pregnant, and they choose to have
Mm,
abortions, even though they tell their husband it's a miscarriage. So I've worked with a lot of women like that are having these secret
mm,
abortions, and then carry the shame. And then, how does a relationship hold that? And how do you get past that? So, it's a terrible, tragic situation. There's one of my clients, she had 3 abortions every time she told her husband it was a miscarriage. And these were babies that
wow.
she wanted. So, to understand what that must do to women when
Yeah.
you think it's me or the baby, literally. This is how hardcore and yeah, how intense this condition is. I didn't have it to that degree, but it is very common for it to be showing up like that. In terms of how prevalent it is, well, the research around this is like all over the place, because a lot of the research is asking pregnant women their level of fear around birth. Now, a lot of women won't even get that far. So they're only
Mm.
asking a tiny proportion. Beyond that, percentages go as low as 4% up to 43, 65%. So
Wow.
we don't really know, I think is what we can say.
Yeah.
But what we do know is tocophobia is on the rise. What we do know is anxiety among women is on the rise, and it's going up staggering rates. And what we also know is that twice as many women have anxiety than men. And nobody's really putting forward an argument or an explanation for that. And I believe that the work that I'm doing is doing that. So that's how the clinic, if we look at it from a clinical perspective, back to your
Yeah.
question about the women that say, oh, well, I don't really like kids. And there are going to be some women in that group that generally do not want to be mothers. And I've had friends like that where they say, I just don't want to have kids. Like that's not
Yeah.
what I see for myself. And if you're able to say that in a very calm, there's no kind of anger there, there's no kind of defensiveness there. It's
Yeah.
just that's just not what I want to
It
do.
just is. It's just life, a
Yeah. And then
pure
a lot of
life
women,
choice.
yeah, exactly. Whereas there are many women that are kind of saying that, but it's got all these conditions. Well, maybe I'll have a foster child, or I'll adopt. And there are these conditions. Well, if I could have an artificial womb, I would, but I'm not going to do it because why should I put myself through that? I mean, it's not fair. Women have got to do this, but men get away with not doing this.
Yeah.
I'm the one carrying all the risk. If there's all of
Yeah.
this going on, chances are you've got tocophobia lurking in the background. Now, the other point that's really important to make is back to the thing about, well, I don't really want kids. I don't like kids. And the closest example I can say is and maybe you can answer this, is, are you a dog person or a cat person? Have you got do you
We
know
are a
which?
dog family.
Yeah,
We
we are
are a dog
dog.
family.
Yeah.
I
But
don't understand cats. I do not understand cats. I apologize to any cat family listening. Don't understand it.
but there are some people that are like, no, I'm not a dog person, and they're just not a dog person. Just like and so, and some people, it's the same thing with kids. I'm just not a baby person. Like I'm crap. I'm terrible with kids. I'm just not interested in kids. And so that might, they've always been like that. And so they just think that's who they are, just like they've never been a dog person, right? But actually, because the root trauma behind tocophobia is very likely to be reproductive in nature, and it's more than likely to be your own birth experience. So that your arrival into the
Mm,
world. So that means you've
wow.
only ever known that. Your whole life outlook has been clouded by the idea that this experience is deeply traumatic and deadly and fatal and terrifying, or whatever your experience was, whether it's coming out the birth canal, being a C-section baby, whatever that was, and whatever mental or emotional state your mother was in during that experience, that is now shaping your entire outlook around the idea of reproduction. And so,
But I'm
of course,
assuming that's very subconscious.
oh, very, very deep and subconscious. And this is why women don't know they've got it, because who remembers their
Mm,
birth? Like
yeah.
nobody remembers
No
their birth.
one. Yeah.
And what's the likelihood that you've even had a conversation with your mother about your birth, right? And you may have done. And what is she going to say? She's going to say, oh, yeah, she might not ever want to talk about it because it was a nightmare. Or she might say, it was great. I had a great time. Whichever, whatever.
Or
But
she may pass on her trauma of your birth to you.
yeah, but the thing is, whatever she experienced is not your experience because you're a
Yeah.
different person. So if
Yeah.
she had a difficult experience and it was traumatic, then you can guarantee that yours was too, because you obviously were going through that experience with her. But if her experience was positive, that does not necessarily mean that yours was too. Because let's say you're coming down the birth canal and your shoulder got a little bit stuck, or the contractions were too tough for you, or you didn't know if it was going to end, and you were like, I don't know what I'm doing. Oh my God, is it going to go? Like you'll have your own things and thoughts and fears going on as you're going through that journey. And then when you came
Mm,
out, what happened then? Did you get held by your mother? Did you have a bright light shone in your face and jabbed with a thing in your ankle? Like, what was that experience as you arrived? So all of that is now shaping that human's experience of reproduction. Now, if you're a female, you know that at some point in your life you might have to confront that, and if you want to be a mother, you're going to have to deal with that.
yeah.
And suddenly, there's no other way for you to give birth or be pregnant and have kids without going through that, confronting all of those fears again. And if they're locked in with trauma, you've now got a very much more meaty
Yeah.
emotional condition on your hands. And so this is why there are some women that might think, well, I'm just not a babies person. I don't like babies. And I don't know if you've seen the film Mr. and Mrs. Smith with Angelina Jolie, but there's a scene in that film where she just holds the baby. Somebody's given her a baby and she's looking at it like it's a dirty underwear. That was totally me, right? I was like, dude, what am I supposed to do with this? Like, take it away. And yet, that was my fear speaking. The minute I healed all of that, oh my
Mm.
God, I love squishy babies and their big cheeks, right?
Yeah,
But I'm
yeah,
not that person, and I would freak out if anybody handed me a
yeah.
baby. So that discomfort around babies, around kids, around pregnancy conversations, around baby scans, around family planning conversations. That discomfort there is tocophobia.
Phobia.
That's how it's
Okay.
showing up.
Now you're rebranding it because tocophobia, you said, no one really knows what that means. You say the word, no one gets it, but you're rebranding it with calling it reproductive anxiety disorder,
Yeah.
which sort of says a little bit more about what it is. Tell me, are there other people out there doing this type of work? Do you have a community? We understand that it's not very well known within the patient community, but is there, sort of the work you're doing to rebrand it, to talk about it, the books you've written, which we'll get to, sort of how are you being received from the practitioner's level, and also this rebranding of the name to make it reflect more of what it is. And again, to specify the difference between the phobia and an anxiety, which I think has
Yeah.
clinical differences.
Yeah. So my background is marketing and branding, so that's why rebranding works for me, right? And also what I think is really important is that in my experience, so having developed my own way of healing my own tocophobia, I then went on, I was a business coach when I fell pregnant, and then I was able to heal this in myself, and loads of women got in touch with me once I'd had my baby, and I don't know how they found out about me, asking me how I did it. Like, how did you do that?
Wow.
I'm terrified. What did you do? So when I'm breastfeeding my newborn and I'm like answering these emails as to what I did, they were quite big emails because I was
Yeah.
unpacking all the fear and then telling them what I did exactly. And so that kind of gave birth to a whole new body of work for me, which led to me writing my book, Fearless Birthing. And so in the book, Fearless Birthing, I describe exactly the process and the method that I've used. And that method has now become my healing modality, which I called head trash clearance, right? So I train practitioners now in head trash clearance. I train doulas, midwives, perinatal professionals, but also
Wow.
coaches and healers in head trash clearance, both applying it around pregnancy and birth, but also in the general population. And it really struck me on one of my training courses, one of our live sessions, when I was like, okay, when it comes to tocophobia, ignore the word phobia and treat it like an anxiety disorder, because we've got a protocol and a way of treating anxiety, and we can do
Yeah.
that very, very quickly using head trash clearance. So I was just like, you just need to ignore the fact that it's a phobia and treat it like an anxiety disorder. And I kept saying this quite a lot. And I was like, hang on a minute, this is ridiculous. Like, why don't we just call it an anxiety disorder for God's sake? Like, we're not like,
Yeah.
this is not helping women get the support that they need.
Yeah.
So I was like,
Yeah.
right, okay, I'm just going to name it differently, because the other thing that I realized is that I happen to be a world expert in tocophobia. And that's not because I'm kind of feeling all big and want to stroke my ego. It's just that when people come to work with me, I ask them why. And they're like, well, you're obviously the global expert on this. I'm like, oh, am I? And that last year I said I had a hard word with myself. I was like, well, what would a global expert do? She'd write a bloody book is what she'd do. So that's why I read the book, right?
Yeah.
So I'm kind of assuming that role now and like acting like a grown-up around this, because it's like nobody
Yeah.
else has this understanding that I've had, because one, I had it, so I know what it's like, and I've healed others with it, and I've been doing it for over a decade. So I've got a very deep understanding of the condition, but more importantly, what it takes to get rid of it. And I can help clients get rid of their tocophobia during their pregnancy. When many women are being advised that it could take 2, 3 years of therapy, I'm like, no, 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 no.
Yeah.
We can do this in a month and 2 months, depending on what your starting point
Wow.
is. And so I'm coming at this from a position of somebody that's lived it, but also somebody that knows it intimately to deal with it and get rid of it. And so that's why I was like, I'm going to take the bull by the horns here and just sort this out, because it needs to be communicated much more clearly. Once women can
Yeah.
recognize this in themselves, they can find the support and healing. And therefore, they can also find the right kind of professional who's trained in the right kind of methods to get the support and the help they need. Because unfortunately, a lot of women are going to their medical professional, their doctors, their sometimes midwives, whoever they're going, their therapist, and they're just getting met with like, oh, I don't know what it is, or maybe it's OCD. Oh, you should go and let's put you in a point
Yeah.
with a maternal mental health unit. So imagine
Yeah.
you've got a fear of pregnancy, and that involves a fear of bumps in general. And now you have an appointment in the maternal mental health unit in a waiting room full of pregnant women, right?
Women. Yeah.
They don't even go to
Yeah.
the appointment because they can't even stay in the room.
Yeah.
This
And I'm
shows
also
how,
sure there's a lot of sort of, I'm sure it's not just the phobia or the anxiety itself, it's everything that comes with it, because as women in our society, we are conditioned that how to fulfill your feminine potential is, you know, get pregnant, have a baby, have a family. That is sort of,
regardless of whether you work or don't work, you could be a nuclear physicist, but you still need to have children. You could be an astronaut, but you still need to, you don't need to just be a stay-at-home mom, not just a stay-at-home mom, but you don't need to be a stay-at-home mom to justify having children. You could, a woman could be anything, but at the end of the day, her role is not complete unless she has children. And so there must be a language, a shame, a sort of like you're going against the cultural tide of what is expected of you to do as a woman in our society.
Yeah. And there is, and until women can really clue into like what they want, a lot of women come to me after that, like during perimenopause or menopause, because they need to now make peace with the fact that they thought that they didn't want kids. So their fear was making the decision for them. And now the potential is now removed. So now there's no chance of them getting pregnant. The fear subsides, and now the truth hits them in the face. And they realize they did want kids. It was fear the whole time. So now they have to make peace with that.
Right.
So this is probably what's driving a lot of perimenopause anxiety without women really realizing what's going on, right? Because now they've got this double whammy of aging and body changing and all the things that menopause and perimenopause bring. And now there's this realization, this harsh truth that's now landing that they haven't fully that hasn't fully crystallized potentially. To recognizing the fact that now they've lost that chance. And so I do get a lot of women coming to me, let's say late 30s, that want to know for sure whether it's the fear talking or them, so that they can make the decision with their heart and not with fear. Because when it's made with your heart, you're not going to regret it. You can live with that choice. When it's made out of fear, now you have the rest of your life in regret and pain, emotional pain of the what ifs, right? So this is why it's so important to help women to make these decisions earlier on in life as possible, which is why I want to raise awareness among not just the pregnant and, the childbearing age, but actually women who are in their 20s, the mothers who have daughters, right? This is why this podcast is so important, because if mothers listening, tell your daughters about this, give them the book, help them understand so that they can start that healing journey early and give themselves that breathing space. I've had women I've worked with in their early 20s that have clued into this. They think, oh, I've got a boyfriend and he started talking about kids and I realized I'm just not comfortable with that idea at all. I'm like, and she goes, I looked it up and I came across your work. And so they've got the luxury of time. They can do the healing work slowly. They can explore it, as opposed to the woman who's 36, who's thinking, oh my goodness, like
time's running out.
And it's all very intense and pressured, right? We need to raise awareness among all women so that we can all support each other and direct the women that may have it to the help that they need, right?
I want to understand the head trash approach and sort of what that all means, but I do want to just clarify something here, because I don't want anyone listening to us to say, women who, let's say, in their 30s and who are, want to put their career first, and once they've reached a certain level in their career, then they'll make space for kids. Like, it's like sort of a complicated topic, because you don't want to shame anyone who's making life choices. At the same time, you want to make space for those women who either recognize they have some type of anxiety around this, or don't recognize they have anxiety, but there is underlying anxiety. How are you pulling apart sort of the pieces here of women who are like, I'm not going to say making excuses, but are giving, rational excuses as to why they want to wait? Like you were focused on your career and you were focused on this, but you were in a long-term relationship and it had never come up. And women who sort of identifying or picking apart, who is the woman who is really struggling knowingly or unknowingly, and who is the woman who is actually making life choices that just ends up being that at the age of 38, she gets pregnant for the first time.
Yeah, I think if you've got any level of anxiety going on, then that's, you're likely, it deserves to be looked at, is all I'm going to say. But if you are like so happy and you're at peace and your health is in great shape and you're like, you've got all the things and you just feel so blissed out and amazing all the time, the chances are you haven't got it going on, right? So it's just about kind of self-reflection. Whereas if there's an underlying low level hum of anxiety that you can't quite you can't pin it down. You can't identify what it is. It's there. It's like a background noise. And you can't, it just feels like it's out of reach. You can't quite name it. that is definitely a candidate for someone that might have it. Now, it might just be anxiety, but one thing I've realized is, I work, I still do a lot of work with a lot of business owners, business leaders, CEOs, and it's, these women are high functioning.
Yeah.
They get shit done. They're like really like they're on it, right? They're really they have a high capacity for getting stuff done. But when you have high functioning anxiety, you manage to find ways of delivering despite what's going
Yes.
on inside, right? So it
Yes.
comes at a great emotional cost, and that's what leads to burnout and all of that kind of things. But when I'm working with women like that, we're kind of peeling apart their anxiety. We always end up landing on the tocophobia. Like it always ends up showing its little head.
Wow.
And it's like the one at the
Wow.
back of the class, and you're like, hang on a minute, well, what's this? And then she says, oh, I've never really wanted kids. And I always thought I didn't want it, and da da da. But now you're saying all of this, this all resonates. And
Right.
so I'm like, well, that's interesting, isn't it? We weren't even talking about that. And now it's kind of like barged in. See
Coming
what it
out.
snuck
Yeah.
in at the back of the class kind of thing
Yeah.
and
Yeah.
showed its head. And so then we end up doing some of my tocophobia healing work as part of like a business anxiety program because it's
Fascinating.
relevant. And actually the key themes around tocophobia are the fundamental themes of anxiety. So what I also discovered, so there's one lady that let's call her Sarah. She had a thriving therapy practice as a therapist, but she also had OCD, a clinical anxiety disorder, and she came to me for tocophobia. So she was 40, desperate. Nothing had worked. Now she was a therapist. She had all of that available
Yes.
to her, right?
Yes. Yes.
Nothing had worked for her. So she came to me. We just specifically looked at tocophobia. Within 5 weeks, everything collapsed. The clinical anxiety went away, the OCD went
Wow.
away, and the tocophobia. But I wasn't looking at the other two. I was
Yeah.
only working on tocophobia. And that is not an isolated story. And what that leads me to believe is actually tocophobia, what I'm now calling reproductive anxiety disorder, is the mother of all anxiety disorders, pun intended. It's the one that all the others hang on.
Wow.
Because when I
Wow.
focus on that, the others just go. We're not even looking at them.
Wow.
And you think about levels of OCD, levels of anxiety, what levels of
Yeah.
anxiety do during perimenopause and menopause.
Yeah. Yeah.
Maybe they're all hanging off this other one that no one's seen yet, which is the reproductive anxiety disorder. And maybe that is why it's being ramped up at key moments during the reproductive cycle. Now, this is rooted in trauma. So the birth one I've mentioned already. And I would say within my clients, about 80% of women, their root trauma is their birth. But there's another one that is very rarely talked about that even it took my teenage daughter to raise this awareness in me. So she went through puberty a few years ago. She's 15 now. And she said to me, well, what was it like? How old are you when you had your first period? And then I was like, oh. And I realized I couldn't remember any of it. My age, no,
Wow.
like nothing, nothing. And now with the
Wow.
hindsight that I have around the work that I do, I'm like, well, holy moly, what does that mean? That means that was traumatic. I've literally blanked that
Yeah.
whole experience out. So then I've got a client, another therapist, who's talking to me about these themes. I'm like, okay, what was your puberty like? She was like, well, da, 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 da. She gave me an answer. I was like, you've got puberty trauma. She's like, I haven't got puberty trauma. I've worked on all my traumas. I'm a trauma therapist. I was like,
Yeah.
just trust me on this one. Let's do the trauma on your puberty. Sure enough, everything collapsed. She had body dysmorphia. She had body images. Like she was struggling with her body big time. She also
Yeah.
had the birth stuff. And that for her was rooted in the puberty experience. Now, what is going on with all of these experiences that makes it relevant? There are the reproductive cycles doing its thing, but also your body is changing.
Yeah.
Nature is doing something that you're not in control of. So when you're a baby in
Yeah.
the birth canal, you're not in control of those contractions. You are literally just going, you're like a passenger for the ride as a baby.
Yeah.
Puberty is the same. We can't control whether we're going to get big
Yeah.
boobs, what our period's going to be like, what age we're going to be,
Yeah.
how we're going to grow, whether they're going to be painful or not. That just kind of hits us. We're not in control of that situation. Pregnancy, the same. We are not in control whether we're going to balloon and get big, whether we're going
Yeah.
to carry it around the front, whether we're going to be having loads of conditions. The birth, the same. Perimenopause, the same. There's this loss of
Exactly.
control around the body and what the body is
Yeah.
doing to us, and we have to surrender to it. And that's why when you have these women that are in high functioning or big, powerful jobs, they have to be in control because it's this loss of
Control.
control that's one of these constant themes, which is also a key theme in anxiety, change,
Yeah.
uncertainty. These are these common themes that run through all of it. So when I'm working with anxiety and we're addressing these themes, this is why it collapses the other anxieties, because actually
Mm.
the birth stuff is fundamental to all of it. Like we wouldn't be here.
Yeah.
without that experience. So of course it
Right.
affects all of us. And I also think it affects guys too. Like I was doing some video work early on in my recording lots of birth content. And this is like a 19-year-old. And I got him really cheap because he was 19, wanted to get some stuff under his belt. And we're half an hour in. He's like, I'm really sorry, but I can't do this anymore. I think I'm going to be sick and faint. I can't listen to what you're saying. I was
Oh
like,
my gosh.
wow. He couldn't listen to any talk about birth or birth canals or anything because it made him want to faint. And I'm like, well, I wonder if you had a traumatic birth experience. So, there are men that don't want to be in the birth space. There are men that don't want to hold
Yeah.
babies. There are men that don't like being
Yeah.
around kids. Maybe there's
Yeah.
that going on for them. Um, who knows, right?
Yeah.
There's not enough research about this. We need to do more.
Yeah. So I want to get back to the head trash clearance protocol,
Yeah,
but I must ask you a question because part of what you're saying, and I'm going to challenge you a little bit because I want to understand more.
yeah,
Part of what you're saying is there's anxiety or trauma around key female life stages. This is what I'm hearing you say
yeah,
around birth, which obviously everyone happens, but around puberty, around fertility years, around perimenopause and menopause, this trauma, anxiety, lack of control, surrendering. Can I be really rude and say something maybe not politically correct?
do it. Yeah,
This is just what it means to be a woman. And I say that from an empowered position, not from a gaslighting position. How can it be that so many women are triggered or traumatized or have increased anxiety from these clear female life stage milestones? I'm trying to understand this because the everything that you've said I'm hearing and I agree with, but something isn't sitting with me right, because this is what it means to be a woman. These milestone life stages are we know, when I talk about perimenopause and menopause, I want to understand it in the context of a woman's life cycle, and I use exactly those milestones: puberty, fertility years, perimenopause, menopause, postmenopause. They are all things out of our control, but there's the biological piece of it, but there's the physical, the emotional, the spiritual, the cognitive, the energetic piece of it. That is what it means to be a woman. So I'm really trying to understand, are you saying, and I know you're not saying, but I don't want it to be that people are listening saying, well, being a woman intrinsically means anxiety and trauma.
what's going on? I think we need to zoom out. And you're absolutely right. What we also need to take into consideration is what's going on, like the world that we're living in and how that's changed. So you think about what environments women are birthing their babies in and the impact of epigenetics and inherited trauma and in utero
Yes.
trauma. And so what we're seeing is we're stacking traumas. So there's accumulated
Mm.
generational trauma that's now stacking on from generation to generation. So
Yeah.
in the 50s, when birth started becoming very medicalized, but before then it was at home, it was among women, there was no fear around it typically,
Yeah.
right? And we still see those environments very much in the East. In the West, it's medicalized, there's a lot of fear. And and then you think about how birth is portrayed in the media. As far as women are concerned, the childbirth pain is the gold standard in pain, and you are guaranteed to experience pain in birth, and
Yes.
nobody can live through that. And so women are being conditioned that birth is going to be the most terrifying, painful,
Yes.
awful event ever. And we're seeing
Yes.
that, there's series on the TV, it's the way it's
Yeah.
portrayed everywhere,
Yeah.
right?
Yeah.
That's another element.
I started my health journey as a yoga for pregnancy and birth teacher. And exactly that. The images that we see are women lying flat on their back with their legs up,
Yeah.
screaming in pain.
Exactly, not evidence-based at all. And so you've got that, and so that started happening. And I was born in a hospital in the 70s. So now that was clearly a traumatic experience for me. And so now that's locked into my epigenetic information, my cellular information. And so now that is going to get passed down. So as you have more generations of women that are having these births, maybe in these environments that are fear-based, that they have a traumatic birth experience, now that is now being passed on. So we've got this kind of epigenetic factor, this inherited trauma that's going on one level, right?
Okay.
Then you've got media and how women are being shown what birth looks like. That's another level. Then you've got just fear porn, just everywhere. Like there's a whole level of fear porn going on that is, even in the last 10 years, COVID, lockdown really took that to a new level. But so you've got this other level of fear. So now you have this compounding situation where you've got inherited trauma that's compounding. Then through an individual woman's life, she might have had the difficult birth to start with. Then she's stacked a puberty trauma on top of that. Now she's stacked maybe a miscarriage trauma or a termination trauma. So now she's collecting her own personal traumas, as well as the one that she inherited from her mother and her grandmother now, because now there's a couple of generations or more that have got that too. So now like the women of today have now got all of that to deal with. Not only they've got their own stuff, they've got their mothers and their grandmothers' stuff that they're carrying without them realizing. And society is throwing more shit at them than they can handle. So now
and to add to that, now the thing that I can't bear is the fear-based menopause trauma. The menopause conversation is only about symptoms, fear, all the products you need so that this doesn't happen to you. The menopause conversation is a fear-based conversation. So that's adding another layer of fear and trauma for women. They just are expecting they're going to have, 50 different symptoms at debilitating levels.
Yeah. So you've got this. So this is what's going on. It's we just can't ignore the bigger patterns that are going on in society.
I understand.
And this accumulation of trauma that's going on. So a lot of women are actually wrestling with, CPTSD possibly without realizing, because they can't name the trauma. They don't realize they have the trauma. And this is what makes it very destabilizing and very difficult to tackle, because how do you, like with me, I was clearly traumatized from my own birth and my puberty, as I discovered as an adult, but I didn't know that. So would I go and get trauma healing for that? No, I wouldn't.
No.
I never really thought I needed therapy. Let me tell you, I needed therapy, right? I never thought that was what I needed. So this is what makes it hard. When you've had a difficult childhood and you've had, let's say there's been situations happening in your childhood that you can go, parents this, neglect, whatever. You know what you're dealing with, and that
identifiable
might not be
trauma.
but you can go, right, I've got that, I'm going to go and get help for that, or you're wrestling with that. But when you haven't got a clue, and you might say, well, there's nothing there, I've had a good childhood, there's nothing for me, this makes it really hard because you can't compute. It doesn't, like, the maths don't add up. So when you have these invisible traumas or these subconscious, these deeply rooted traumas, this is what makes it so hard, because you just don't understand why you've got this going on. Nothing seems to make sense. But I cannot impress the importance of something like in utero trauma, like so many, even from my own experience of the traumas that I picked up in utero and how they shaped my life and the way that I was, the blueprint that gets set into place when you're when you're being carried by your mother. I've worked with adopted women that don't understand why they've got a fantastic birth family. They've been given all the opportunities, and yet they feel abandoned and rejected, and they can't shake that. And that's because that's what they picked up in utero. And until we go back into the in utero experience and heal those traumas, they can't let that stuff go. But they're living their life thinking, I don't know, my birth family are amazing. They love me, they adore me, they've given me all the opportunities. Things don't add up. So this is what we need to open up the scope and recognize that, in utero, birth experiences, intergenerational trauma, inherited trauma are really important places to start looking to help to relieve all this. And we haven't. So we've got this problem where we've just got an accumulation of trauma that are landing on today's generation's doorstep, and they're like drowning in it.
Yeah. Okay. So you fully depressed me.
Sorry.
No, I'm joking. What do we do about this? So I want you to talk about a little bit your protocol, your head trash clearance sort of modality that you've developed, because I hear what you say. I recognize what you say. I understand this is a real issue. Women are really struggling, knowingly, unknowingly. What happens next? What's the next step?
So the head trash cleanse. So I developed it when I was pregnant, and I didn't have the budget. I thought my therapy bill would be enormous because suddenly it hit me exactly what in a mess I was. And also I didn't have the time, right? I was pregnant, so you can't shift a due date. You can't go, quick, just put that one back, please, unless you make a difficult decision, which a lot of women do, right? But I wasn't up for that decision personally. And so I developed a way for me to heal my own fears, to clear my own fears. And I tested it. My first opportunity was at my first significant midwife appointment. And so she's doing all the things, filling all the things. And then she says, oh, we'll do the injections. And then I went, what injection? What injections?
Yes.
I lifelong injection phobia person. I would faint at every injection. Like I'd always be carried out of the doctor's surgery. So now she's mentioned the injection word, I'm like, I'm not listening. Like I've clocked out now, and I'm like silently panicking. And then her bedside manner was terrible, and she carried on, and I'm just not there anymore. And then she sort of says, oh, you scared of injections? I'm like, yeah, don't worry, my love. Sit outside while I get all the needles ready. I'm like, not helping. So she puts me
Yeah.
outside, and I'm outside and I'm thinking, okay, this is a nightmare. And I looked in the sky, not the sky up there, and to the technique that I've been playing with. I was like, right, if you're any bloody good, this is your chance to show me. So I tried it there and then in the corridor. I didn't have very long because it was only 3 needles as it
Yeah.
happened. So it was about 5 minutes. And then she called me back in. She went, so you're scared of needles, are you? I was like, no. And I was like, who the hell said that? So then I'm like, oh, this is weird. So then she kind of goes to give me my injection. I'm sitting there going, well, hang on, I've never had this experience before. And I walked out and I walked out on my own and it was all fine.
Wow.
And I was like, well, that was what the hell happened there? And then the next month, because I had rhesus, whatever they needed to do, and take
Yeah.
injections every month. And the next, I had all these midwives, different ones every time because the NHS. She said, "You've got to be the calmest person I've ever given an injection to." I was like, "Are you having a laugh?" But that experience showed me what I just created. And I was like, right. I got home and I wrote out every fear that I had around pregnancy and birth. And I just worked on them like an absolute demon. And it's like a to-do list. I wrote it all out and I cleared them. And in month 7, so in 2 months, I shifted my plan, my birth plan for a C-section with all the drugs because I wanted to be knocked out cold. I didn't want to be
Yeah.
present in that
Yeah.
room. I was like, you
Yeah.
just cut me
Yeah.
open, show me the baby later. To planning having home birth. And I had a home birth, pain-free home birth, and it was amazing.
Wow.
And so I made that decision in month 7. And I was using the technique all through my labor because fears kept popping up, you know.
Yeah.
So I was even using it in between contractions right at the end. So, you know, it works so fast you can use it in that 3-minute window in between contractions. So it's a very useful DIY method to use whenever you've got stuff going on. And as I started teaching it to more women, I had then therapists wanted to get in touch, doulas, midwives going, well, we're going to use this with women. So, and then I've developed it further. So I've now developed a trauma healing protocol. So it's now been developed in a full modality where it could, if you wanted to
Wow.
it and it be the only thing that you learn, you could just train that. I had one therapist training me. She goes, if only I'd met you 10 years ago, I would have saved 70 grand in training in therapy. I don't need
Wow.
any of that now. I can just work with this. So it's a very meaty, substantial, powerful method. But importantly, it works really well DIY. Professionals go much deeper with it, but you can do it on your own. And it's in my book, Fearless Birthing. That's why I shared it first. And in my book, Clear Your Head Trash, and now my recent book, Clear Your Anxiety for Good. I share it willingly everywhere. If you want to get on with it, it's a 5-step
Yeah.
process. It's very easy to use. You can, like I've said, you can use it in a birth ball in between contractions or
Yeah.
at home in bed, wherever it is, right? Just not.
Now you're using this technique for very specific anxiety conditions. Can it be used for generalized trauma, anxiety, depression? Are you seeing that it can be sort of used in for other cohorts, other demographics?
Oh, anybody can use it. So I developed it in the context of that, but the technique doesn't care if you're clearing a fear of birth or if you're clearing a fear of pain or being rejected, being liked, you know, speaking to the board.
Yeah.
Like it doesn't matter because it's a technique that just works with wherever the resistance is, whatever the fear is, whatever is triggering you emotionally, you can
Yeah.
use it on anything. You can even use it on like I never used to like the color green, right? My best friend liked green, I like red. I did a clearance on green and now I love the color green. Right? So you know, you don't. It's not restricted to anxiety around birth or pregnancy. You can use it on
Yeah.
any kind of anxiety or any kind of fear, self-sabotage, trauma. Makes no odds. It's just a very
Wow.
useful healing tool to have for yourself, you know, and this is why I have a lot of therapists coming to me because the therapists need this. They in order to hold the space for women, for people now where we've got mental health going off the charts in terms of the crisis, the therapists are the ones that everyone's going to, and they need to be a hold that space.
Yes.
They need this work.
Yes.
So this is why they love
Yes.
the technique because they're getting now to work on themselves and do important work that means that they can now hold the space for what's going on with their clients. So no, it
Wow.
doesn't discriminate in terms of what you work on.
Wow. And being one of the few, if maybe only people dealing with this, how are you sort of sharing this and how are you getting this recognized by the medical community?
Well, this is all very new, and it's going on podcasts like this. It's helping you to raise awareness. So I've written a white paper around the case for reproductive anxiety disorder. So that's really for the researchers, the academic population, so that we can start doing meaningful research around this, and importantly, take the research outside of the maternal section in terms of the
Yeah.
pregnancy, childbirth, midwifery department, and put it in the mental health department because this
Right.
needs to be language. This needs to be research that is explored, but understood by therapists, understood by perinatal psychologists, understood by broader psychologists, understood by doctors. They
Yeah.
need to be nurses who are doing cervical screenings need to know about
Yeah.
it, so that when they
Yeah.
have a woman
Yeah.
who's coming in for a pap smear, who's demonstrating that she's, they have chit chats that time, and she could say, oh, you think about kids, and oh, no, 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 but she might
Yeah.
react in that moment. You go, oh, maybe you've got da 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 da, and start
Yeah.
signposting early on in a woman's life so she can
Yeah.
find the right information. So my intention with this is to get more research done, connect and collaborate with professionals doing this kind of research into tocophobia, into
Yeah.
reproductive anxiety, and start training. I've now launched some trainings for professionals around this. So I've got a free
Amazing.
We're now masterclass for any kind of medical professional who wants to better understand reproductive anxiety disorder and tocophobia. I've got a more in-depth training. I've also got ethics training around this for professionals. And then, of course, if professionals want to learn be a practitioner in my method so that they can actually
Yeah.
work with women like this in a meaningful way. Yeah, there's lots going on as I try and
It,
get the word out there.
yeah. I mean, it sounds like your branding and marketing business is going to be highly like that. Those skill sets is really important here because you're basically creating, not create, I mean, the condition exists, but you're creating a whole niche area of understanding for a condition that is totally not known about.
Yeah, and niche is an interesting word, and I'm all about niche as being a marketing person. But when
Yeah.
you have an anxiety disorder that affects probably 50 to 60% of women, we're not talking niche, we're talking mainstream. This is the
Yeah.
problem, is that
Yeah.
why do women suffer with twice the level of anxiety than men? Is it hormones? Like these things don't
Yeah.
answer the question. And one thing I do know about hormones with my own experience is that hormones amplify what is already there, right? So I
Mm,
haven't got perimenopausal anxiety. I haven't got brain fog. I'm more productive than I've ever been. I don't need that much sleep. I have buckets of energy. Like, yes,
yeah.
there are some symptoms I've got with perimenopause and menopause, which I can point to cortisol, belly fat as one of them, right?
Yeah.
But the other symptoms, they're just passing me by. Now, I'm not saying that that's by no means a proof of anything, but isn't it interesting that having
Yeah.
done a lot of that work and that inner work, that I'm not getting
Yeah.
some of these obvious perimenopause menopause symptoms. So maybe some of the what we need to be doing here is inviting women to explore this aspect within themselves early on in their life, so
Yeah.
that they can be addressing this as they go through life, which means
Yeah.
that by the time they hit perimenopause, they're not dealing with the mother of all anxiety disorders at that point. They've kind of been chipping it away the whole life, and they're
The
not
whole
compounding
time.
traumas. That's why it's important to get this out there so that we can help women get the best support they can get.
Yeah, amazing. And I guess just one of the last questions is sort of what is your end goal in terms of the way that women feel? I mean, you've sort of expressed it a little bit, but is it that there is no more trauma? Is it that there is no more anxiety? Or is it that they've got the tools to deal with it if they see something arise?
I think having no more trauma anxiety would be a bit rainbows and unicorns because
Yes.
there's just stuff going on in the world that's traumatic, right?
Yes.
But what we can do is we can minimize we can minimize the impact of those external events. So as we build our own
Right.
internal resilience, the same event doesn't affect everybody the same. How it affects
Yeah.
you depends on your internal emotional infrastructure. So if you've done the strengthening work, the resilience work, then you are not going to get traumatized by the same situation that maybe somebody else has. So by giving
Right.
people the resilience, by giving them the tools for them to manage their own mental health and emotional well-being, means that you're better equipping them to deal with life in modern
Yeah.
times. And that's why I think head trash clearance is brilliant, because it is DIY. Once you've learned it, it's very simple. It's a 5-step method. You can just use it on whatever, whether you've had a crappy meeting with your boss at work, you can just go into the toilet, do a clearance and be back ready to deal with your day.
Right.
So it's very easy. So by giving people the tools, now they're empowered and they are in charge
Yeah.
of their own mental health and well-being.
Yeah.
That is what I want, is people to be equipped. And so I'm really all about, and because my background is marketing and business and branding and products, I've just created loads of little products. So you don't need me. I don't see myself as a therapist. I am not a therapist. I've created lots of ways to make this accessible to people, digital programs so that you can help. So the books, you can use
Yeah.
any of the books to do the healing yourself. If you need help, guidance, roadmaps, whatever it is, then come to my websites to get the structure that you might need or the accountability that you might need. I call it SAS. If you want to heal with SAS, then you've got structure, you've got accountability, you've got support, and you've got speedy shortcuts. So all of those things is what I
Wow.
offer. So depending on where you need to dial that up, I've got the thing, right? And if you want high level one-to-one, yeah, but most people can't afford that right now.
Yeah,
But they
yeah,
still need, they can't afford to go to a therapist. So we need to start giving people this emotional strength so that they can be happy at the end of the day. I want people to be happy. And
yeah,
doing this inner
yeah,
work, unfortunately, is kind of what's needed right now because of this accumulation that I've talked about. Nobody's really
yeah,
escaped that accumulation of crap, of head trash that's
yeah,
been building throughout
yeah,
generations. And so the thing about head trash is it's not nothing to be ashamed of. Like we've all got it. If I came to your house, I wouldn't be standing by your kitchen bin going, "Oh my God, Jacqueline, look at all that rubbish in your bin. What are you like?" You'd be like, yeah, I went to the supermarket last week and there was packaging and I had to get rid of it. Like
yeah.
it's just that's the
It
part of the
just
core.
is. It's part of being a
Exactly.
human. It's just part
No,
of being a
exactly. I
human.
lived and I needed that fear, that doubt, that whatever to help me when I was 7 or when I was 12. But
Yeah,
I don't need it anymore. But it's still rattling around up there and I just need to get rid of it. So
yeah,
it is this accumulation of all these doubts and fears and things that we're still carrying that are just
yeah.
outdated and we need to just get rid of them and free up that space so that we can focus on the life that we're living today. And that's
That
what
you
head
want to
Trash
live.
Coach does. It just helps you get rid of all that old stuff that you don't need up there
Wow.
that's taking up energy and space. And so you focus on the here and now and be present. And that's what I want people to do is just be equipped and come and learn the method. Then you can just do it yourself, right?
Yeah, yeah. No, it sounds phenomenal. And you really are creating a whole world that really no one really knows about. So it's really amazing. The white paper you mentioned, what is the intention with that white paper and how are you sort of, because you need to get this out there. People need to know about it.
I know.
Medical professionals need to know about it. There needs to be more research about it. You need to, you need to have, I guess, medical practitioners, whether they be, midwives and doulas or doctors and therapists or whatever it is, they need to know that this exists because that's the first thing. People don't even know that this is a thing.
Yeah, yeah. So I would anybody listening that is that, please do get in touch because I'm looking for collaborations. I'm looking for people that are plugged into those ways. I'm not plugged into that, but also I've got to earn money doing what I'm doing. So I can't just like, oh,
Yeah,
I'm the next 2 or 3 weeks, I'm just going to start emailing everybody around the world and doing, that
yeah,
takes time, right? And that also, so I've got to balance up, making sure I keep the business going, doing the things that are going to generate the revenue, but also raise awareness as well. So that's why I have these
yeah,
these initiatives on the side that help. If there's somebody listening that goes, I'd love to do some research around this, and yes, please do get in touch. I've got the white paper that you can read. It's free. I've got two white papers, one on fear and how it's perpetuated in the fear porn that we're living in, and the other one about the case for rad. So they're both available for free at the Fearless Birthing website. You can just come and download it. No email address, nothing. Just come and get it, read it. Then you can come and get in
wow,
touch and ask me any questions about that, so that we can get this out there. Because yes, it's like a personal mission of mine, but I've also got to
yeah,
balance it very carefully with I've got to I train professionals. Also, I also have people that work with me, and I also
yeah,
want to create products and solutions that means that people can access this kind of support without necessarily spending the money. You could be going to
yeah.
therapy for a year, 2 years. I mean, people go years in therapy and spending three,
Years,
five, ten
years.
grand on that kind of thing. And it might not really be moving the needle in the way that they need it to.
Yeah,
So it's to offer people an alternative that means they can
wow.
get the result they want without necessarily paying that kind of money. So it makes it affordable and accessible. And that's what I really want to do.
And what I love about you is that you have been doing this for 10 years, as you've said, and you've seen the results with your own eyes. It's not, something that is in theory. It's not something that you've sort of just done research over. It's actually, you've got social proof of the clients you've worked with that
Yeah,
this works. I'm assuming with all different people in all different situations. And,
yeah,
and
yeah. All over the
that's what I
world.
love about
Yeah.
what you're doing. It's not that you're just sort of created this thing and want to share about it. You've created this thing, you've seen it works, and now you're sharing it all.
Yeah, yeah. And I think over the last 10 years, I was testing it. It was in test mode. And last year I decided I
Yeah.
needed to go, like, test mode is over now. I know this works. I know this works in all these situations. I know it works all these
Yeah.
different types of populations. I've worked with a
Yeah.
huge number of, whether it's celebrities, whether it's CEOs and business owners, whether it's mothers that are struggling, whether it's men that are struggling, like all different populations across different aspects of what's going on in their psyche. So I know the levers that you need to pull and change
Yeah.
internally
Yeah.
to get the
Yeah.
result. And I've been sharpening that and refining it. And so now it's time for me to really just get it out there in a much bigger way. And so that's why I'm just up
Amazing.
for conversations like this. I'm really grateful that to come on your podcast
Yeah.
and talk about it because this is the kind of thing that we need to do. I need to be doing more of to get the word out there. So I really
Yeah.
appreciate
Yeah.
you.
It's amazing. I'm really so excited about this work. I'm excited that you've educated me about something that I really didn't know anything about. I definitely want to go and explore the head trash because for me, I'm in that space at the moment where I'm a mom of kids, ranging from 23 to 12, and I'm dealing with teenagers and all kids who are, as just life is, as you've said, dealing with a whole range of different challenges. And as you said, therapy is expensive when you've got 5 kids. So
Well, on that, we're starting. One of my practitioners, we're about to start. It's literally we're conceiving it right now as a teen anxiety group on school. So it's so that
wow.
parents can. So we're starting out at the moment with our own kids and their friends, because
Wow.
teens are wrestling with all sorts of anxiety right now. And so it's to enable them to learn the method, but to help them work on things that can help them to improve their resilience in school, dealing with what's going on at school so they can better learn, better pay attention, but also just be happier because teens are really in the hot, like they're in the crossfire right now with what's going on. So yeah, taking this to teens is kind of a next. One of my practitioners is doing that. So yeah, I might have
Yeah.
more to share on the teen front very soon.
Yeah, it's enough. Please, when you have that information and that book and that content, please come back because I think that one of the things that parents are really struggling with is the reality of teen life and what teens are exposed to and what's going on and what teens are really struggling with and the mental health crisis that is happening not only in adults but within teens. So, Alexia, you are invited back, please, when you have more to share about that.
I
I would
will. I'll
love,
let you
love,
know.
love to have you back. Before then, though, before our part 2, whenever that happens, as you know, this podcast is called the Things I Want My Daughters to Know podcast. And this is, about the things that I want to share with my daughters. You said you have daughters. Even if you didn't, what is the message you want to share with that next generation? Daughters, goddaughters, nieces, that next generation of girls coming up. What is the message that they really need to be taking away from, as
Well,
you see it?
anything that's given to, that they don't have to take anything at face value. They are in charge. They can control. They can be in not in control. I don't like the word control. I don't like the word charge. But they are in control of their own destiny. Like if they don't like how they
Yeah.
feel about something, we can work with that. If they don't like how they're responding to something, we can work with that. If they don't, everything is within their remit, their grasp. They
Yeah.
have the power to create the future that they want. And I don't think that was really communicated to me. I felt like things were happening to me, and
Yes.
I want them to
Your
know that
parents
they,
tell you what to do. Your parents are in control. School
yeah.
is in control. Yeah. Yeah.
Whereas I think they need to understand that you're in control and you have the power to do whatever the hell you want. We just have to nurture them, guide them so that they're doing things with good guidance and good values that
Yeah.
are good intentions
Yeah.
behind it. Not like, oh, I'm just going to crash the car because I wanted to. It's
Yeah.
being nurtured and supported and holding the space for them to be able to make those decisions themselves that they can live with that aren't driven by fear. So I've got
Yeah.
my daughters that like coming to me going, I want to work on this stuff because I want to be able to I want to do that. So it's letting them know that they can do that and actually,
Yeah. Yeah.
and I think that's really exciting. And I'm really excited to do that with my daughters as they coming to an age where they want to start learning this stuff. So
Yeah.
yeah,
Yeah, I think to empower them and to know that they can be in control. But as you said, it's not just like be in control, go out, party, drinking until 5
yeah,
a.m. in the morning. It's what do you do? And I think that's maybe a reason why traditionally it was parents are in control, teachers are in control, because we didn't trust our
yeah.
teens to make wise decisions.
Mm,
But if you, as you said, it's guidance, giving them the
yeah.
guidance and the language and the knowledge to use that control in a in
Mm.
a in a
Because the
good
kids
way.
today, they're a different breed entirely. They're like humans 2.0. They're not like we were. So they've
Yeah.
got a lot of stuff that we didn't have. They're a different model entirely. So we can trust them. We just need to be
Yeah.
okay to trust them. And I think a lot of
Yeah.
parents don't trust them and let go, and
Yeah.
they have this control. And this
Yeah.
sense of control maybe goes back to reproductive anxiety disorder, that need to control everything, right? Maybe, right? So it's to back off and let them figure things out for themselves so
Yeah.
they can be the strong, independent humans that they absolutely need to be because they've got some big decisions. That generation have got big decisions on their plates with what's
Yeah.
going on in the world. And we need to trust them that they're going to be able to sort it out because it's going to be down to them very soon to do so. So
Yeah.
that's what I want for them.
Wow. Well, thank you. This has been amazing. You've educated me, you've educated my listeners. I want to support you any way I can because you're really creating a whole new movement here. So, really, I really am in awe of what you're doing, and definitely want you back when you start talking about teens and trauma and anxiety. So keep me posted. Where can people find you? Where can they reach out to you? Where can they get your books? Where can they learn more about what you're doing?
So you can come at the Head Trash website, so head-trash.com is all things head trash, whether you want to train, whether you want to clear your own head trash, like workplace stuff, whatever, it's all happening at the Head Trash website. The Fearless Birthing website is where all birth and pregnancy related stuff happens, whether you're a doula, a midwife, or a woman struggling with tocophobia. My white papers are there. Yeah, so just come to either of the websites. I'm also on Substack, just started a Substack for stuff. I'm on LinkedIn, Facebook, all the usual places like that. But yeah, go to the websites. That's probably a good place to start. And the books are on Amazon.
Amazing.
So Your Anxiety for Good is on Amazon. Betrayed by Your Biology is on Amazon. You can also buy those directly from me if you don't want to pay Jeff Bezos, so you can do that too. All links at the Head Trash website or the Fearless Birthing website.
Amazing. Alexia, thank you so, so much. This has been really, really wonderful. Good luck with everything, really.
Thank you.
And for anyone listening that this is all of a sudden resonating with them and they're thinking, oh my gosh, wow, this now explains so much about what I was going through. Reach out to Alexia, go check out her website, check out all the work she's doing. And really, it's just been wonderful to chat with you. And thank you, everyone, for joining me at this episode of the Things I Want My Daughters to Know podcast. Join me next week for another episode. Episodes are coming out every week. Like, review, share, all the good things that you should be doing with this podcast. Look forward to seeing you at another episode. Have a great day.
Thank you.